Good morning, everyone, and welcome to this month's bi-monthly institutional webinar for Health Data Research UK. Just clicking my slides on. Right, there we go. So welcome. So for those of you who are new to these webinars, we hold these every other month, first Tuesday of every other month at 11 o'clock. And these webinars are open to all of Health Data Research UK's investigators, researchers, postdocs, tech teams, students, fellows, management teams, and so on and so on and so on. And they're also open to the public. So we always have a similar kind of structure to these webinars. So there's a slot at the beginning where we hear about each other's research, science, or technology-based activities. And then we have a Q&A, sort of fireside chat around a topic of interest. And then we finish off with some news and updates from HDR UK Central, including upcoming events and so on. So all this is to help to build the One Institute ethos of this nationally distributed organisation. And it's very much an interactive endeavour. So if you have questions, please locate the Q&A facility. And if you have questions throughout the next hour or so, then just tap them in anytime and we'll come to them at the point. So my name is Melissa Lewis-Brown. I'm Science Manager here at Health Data Research UK Central, and I'll be hosting the webinar. We're joined by Jerry Riley, who's our Chief Technology Officer, who will be giving us an introduction and a demo of the Health Data Research Innovation Gateway. Then we'll be joined by Jonathan Stern, who's one of our newest research directors of HDR UK Southwest, a Better Care site, one of our newest sites, to introduce that site and some of the work that they'll be doing. And then, as ever, we'll round off with Ros Walker, who's our Chief Science Strategy Officer, who'll give us a roundup of the latest HDR UK Central news. So without further ado then, I shall hand over to Jerry to give us an introduction and a demo of the Health Data Research Innovation Gateway. Thank you, Jerry.
Okay, thank you, Melissa. So I'm going to just quickly get the screen share going so that we're ready to go first. Okay, so good morning, everybody. So what I want to do this morning is just give you a very quick introduction. I'm not going to do any slides, but I'm going to live demo. So let's pray to the broadband gods this is going to work okay, and take you through some of the features in the Innovation Gateway. As some of you will be already aware, we started work on the Gateway as a minimum viable product at the end of last year, running through and releasing a minimum viable product earlier this year. And we, over the spring period, we were in a selection cycle to recruit a technology partner to work with us and the community to collaborate on building out the long-term phase for the Innovation Gateway. So in April, we selected PA Consulting to work with us, and we released the first new beta on the 2nd of June. So we are just over a month. We're five sprints into the work on the Innovation Gateway. So we will have another release actually coming in about a week's time. So I'm going to show some of the things that are live today, but I am actually going to flip to the test environment just to show one or two things that will be coming on along in a week's time. So please feel free to add any questions in the chat. Please feel free to also log on to the website and play along as well. So the Innovation Gateway is located at healthdatagateway.org. So if we go to the healthdatagateway.org site, this will take us to the landing page. And on the landing page, you have access to some of the key points, key links into the gateway. And on here, you can see the number of registered users we have, the number of data sets that are currently represented by metadata on the gateway, the number of access requests that have been made, and the number of searches over the last month. So you've got some of the key statistics of activity. You have some shortcuts to datasets, tools, and community, and I'll talk more about these later, plus some of the recent searches and what has been proving popular. One of the things we've been doing differently with the Gateway after the MVP focused very much on just data sets, but with the gateway, as we're starting now to evolve it out, we're trying to make it a space where you can search and discover data sets, yes, but also tools, projects, and potential collaborators, and also we'll be very shortly adding some of the training material as well. So we're trying to make it a more sort of all-encompassing space for the community to look for resources, but also to work with those resources to submit access requests to data sets, but also to collaborate across the community. Now, obviously, one of the things that's been very much uppermost in all of our minds recently has been COVID-19. So on here, we have put in some very specific COVID-19 capability, and this will be enhanced in the coming release. So on the COVID-19 pages, if you click through to the COVID-19 pages, you can see the data sets that were represented, the papers and projects, and there's been a lot of activity around papers and preprints, research questions, and tools. So these are updated live from the site. So as these are enhanced, you will see new content. So if I go back, so now if I do a simple search, so we can do a simple search for let's stick on the COVID-19 theme for a minute. So we'll do a simple search. This will take us through to the results. So this will show us that we currently have 9 data sets showing that are tagged with COVID-19, 10 tools, 85 projects, which are the research questions that we've been prioritizing through the funnel for SAGE, and 3 people have tagged themselves. So we can click through the tabs to see what's available, and we have filtering so that if you want to just concentrate down on a particular area, you can filter down into that particular area. So as we go down to a data set, we can track down into the data set to see more details around the data set. So we can see the description, access capabilities, and some of the basic metadata around the data set. And we can go down into the details that are held in the metadata catalog by tracking through to the technical metadata. The format of this page will be changing in a week's time, so I'm going to flip to the format for the user test environment. So as you see, we've changed so the tagging's clear right from the top of the page. We have a description on the page of the quality of the metadata. We've tried to make this a little bit more visual in the new release, and we've changed the formatting of the metadata that we're rendering on the details page to try and draw through some of the more critical, what we think is the more critical information. So once we've got our data set, one of the key things we want to be able to do is be able to log in and perhaps request access to the data set. I have logged in already, so let me log out a moment. So if I log in, I have the ability to log in through LinkedIn, through Google, or through an Open Athens account. So I'm going to go in LinkedIn through my LinkedIn account. I will just take us back to, so if I go back to the question, and I go down to that data. It's a very simple form. We are working with the major data custodians to build out a new access process, which you will see come out over the next few weeks and months, which will be a much more comprehensive approach to access request management. This isn't to replace the processes of the data custodians, but what we're trying to do is build a more harmonized approach. So perhaps in a webinar in a few months' time, I'll take you through the new approach on access request management. But today, you can still submit this, fill out the details here, and for some data sets, including this particular data set, this will act as the data access request, submit, and it will go off to the data custodian. Also, if I go to my account, I can see details of notifications that might be of interest. I can see the projects I'm a member of. I can see the tools. As talked earlier, we have tools and projects as well as people. We can also now enter comments on projects and tools. So this becomes a site for collaboration. If you've got tools that are of interest, really simple to add a tool to the site. You can just go into the add a new tool form, add details of the form. It is tagged, so you can pick up some of the tags automatically, or you can add your own tags. And very simple features and topics which are tags, which will help with the searching for new projects. Likewise, the same works for projects. If I come across, if I want to add a project, and a project could be a research question, it could be a collaboration, so a project can involve multiple people. You can add these details very simply to the site, and you can add other authors to the site, so you can build this up as a collaboration across your teams. One of the other things we really are keen to push at this point, and this is we're in a very early stage of this journey. As I said, we're only 10 weeks into the project, which is going to be at least a 2-year project, is to make this a space for collaboration. So we have started building a set of forums into the site using the discourse tool. So you are able to start a discussion and a collaboration on the site. So going through the site, you do need to be logged in to be able to use the discourse tool, but you're able to enter comments, enter discussions, and set up your own forums for discussion as well. So we're trying to concentrate on really 3 things at this stage. The first is to make discovery across data sets, tools, and projects much more easy. To build a much smoother process to access request management, but also to make this a space where there can be open collaboration around health data across the UK. We want this to be your site, not our site. We're trying to do this very much as a collaborative development exercise. One other thing that I just want to briefly touch on that will be coming out next week is a concept that we call collections. So if I go to our test environment again, you'll see now I have a few more things under my account. I have my access requests, which will be logged and I can track them through. But I also have a new concept called collections. Collections allow you to group together data sets and tools and projects that might be of interest to you personally or to a community, so across a particular project. So I can create a collection. I'll just give it an arbitrary name for now, good old-fashioned test. And I can go down here and I can add resources. So I can do a search. So let's stick with the theme for today. So I can do a search. And I can go through here. I'm in a test environment, so the numbers aren't quite the same. I can select. I'll select a couple of data sets. And as I select, I can see down at the bottom left-hand corner of the screen that I have 2 entities selected. I'll put a tool in here. Maybe there's a couple of questions that are interesting. And I can add these resources to my collection. I now have a collection which has a set of resources, and I can put a URL to an image in there if I want a nice image with this as well. So that will be coming next week. It will, I hope, allow people to use the site in a very different way by grouping together entities that are related, and also as a shop front for your projects or your collaborations. And as we go back, and those will be private to the group that's set up, but it will also be possible for us to feature particular collections and make those collections, which will then be featured on the new landing page. So very quick run through of what we're doing with the health Data Research Innovation Gateway. Very early stages. I'd love you to come and explore it, use it. It is live. There is real things you can be doing here around discovery, around data sets and access request management. But also we want this to become a collaborative space. So come and contribute your ideas. If there's things you think would be important to you, let us know. There is feedback through the site. The forums are there also to feedback requirements to us. And we also want to involve the community in the development of this. We want this to be very much a collaborative development, so we end up with a superb resource for health data research in the UK. And the final thing, we're doing this in the open. We are working with PA Consulting as our development partners. It's very much a development collaboration, but everything we're doing with the site, all the tools we're building on the site are going to be open source. So if you are wanting to contribute, if you're wanting to use what we're doing, we very much welcome this. We really want this to be an exemplar of a collaboration across the whole of the community. So with that, I will stop sharing my screen and I will hand back to Melissa.
Thank you, Jerry. That's great. A great run through. And yeah, as Jerry says, that you can go and have a play yourselves now to see what the gateway is all about. So please do send your questions through on the Q&A function. So there's a question around closed non-public discussions in the group. I think that might be referring to discourse within Gateway.
Not yet. Collections can be closed, but at the moment forums are public. We will consider extending that. Discourse obviously supports this, but what we've implemented so far are public forums.
Okay, so possibly one for the future.
Possibly one for the future, but in many ways, what we'd really like to encourage is open discussion. So yes, probably it is something we'll do, but actually we want things to occur in the open as much as possible. Okay.
And then there's a question around real-time surveillance. I'm not sure whether this question is for this session or potentially the next one with Jonathan. But the question is real-time surveillance a feature of health data? And then just added to that was that this is specific to population health management with the development of ICSs in England.
Not sure that's one for me.
That's possibly one for Jonathan.
We might come to that.
Okay. Okay. Well, if there, so we'll park that question for a little later then. Perhaps. Thank you for that one. And unless there are any other questions that come through in the next 5 seconds, then we'll move on to Jonathan.
If there's any other questions, just go to the site, enter them in discourse, and we will address them.
Great. Thank you very much, Jerry. And I'm glad the live demo went well. So, Jonathan Stern, a very warm welcome to Health Data Research UK. So Jonathan is Professor of Medical Statistics and Epidemiology and also Deputy Director NIHR Bristol Biomedical Research Centre at the University of Bristol. And also HDR UK's newest research, one of HDR UK's newest research directors, now leading one of our 2 new sites, HDR UK Southwest, which is the subject of this fireside chat. So it's wonderful to welcome you to the HDR UK family. You're on mute at the moment. So perhaps we'll kick off with, if I just ask you to tell us a bit about yourself and the new Better Care site that you now lead.
Well, you've pretty much done it all, Melissa, but if I try and build on it a little bit, I've got a long-standing interest in using routinely collected health data to try to learn about effects of interventions when randomized trial data aren't available, and also looking at prognosis, predicting how patients are going to do, and particularly in the context of HIV. And then we established an NIHR Biomedical Research Centre in Bristol, and one of the missions of NIHR BRCs is to build work on health data informatics using routinely collected data to improve patient care. And so I lead our cross-cutting theme on informatics, and we've been trying to work to collaborate, for example, with the NIHR Health Informatics Collaborative, building and doing work with them and providing data to that collaboration. And we've also been working with partners in our partners in the local NHS to build research based on linked routinely collected data. So when HDR UK decided to establish these things called Better Care Partnerships, we thought it fitted very well with the sort of work we'd been building anyway. And so we applied to establish one of these Better Care Partnerships. And I'm delighted to say that we were successful, and that is the basis of our new Southwest site for HDR UK.
Fantastic. And so you're absolutely sort of just getting started. And I just wondered, what are your priorities for the kind of first few months of the partnership?
Well, it seems for all of us, anything before the middle of March this year seems like prehistory, of course. And the application deadline was the 11th of March. And I remember that I was supposed to be going off to an HIV conference in the States just around the time of the application deadline, and that was cancelled. And even if the conference was cancelled, even if I'd gone, I would have spent all my time working on this application. So we sent in the application before the lockdown, and we proposed 4 projects, one on better prediction of who's going to need intensive care, one on predicting on better use of antimicrobials and predicting antimicrobial resistance, one on understanding barriers to discharge from hospital and balancing out costs of social care with costs of delayed discharge, and one on improving the efficiency of scheduling elective surgery, all using linked routinely collected data. And that was, as I say, prehistory on the 11th of March. Then the lockdown happened, and by the time that we were interviewed on a Zoom call, and we included a slide on COVID-19 and how that was going to affect the health system. And by the time the site was established, of course, we were on full lockdown, and everyone's attention had turned overwhelmingly to COVID-19. So really, since then, in the last 3 months, we've been doing 2 sets of things. One is to get the projects going in the context of the lockdown, where employing staff is more difficult, and having meetings is more difficult, and we're all constantly on video calls every day. But the other thing is to build on the work that we were already doing to help to work with the local health system to manage COVID-19. And that means trying to make sure that we're linking information on COVID-19 hospitalizations and admissions to intensive care and deaths with our linked primary care data. And we're thinking very hard at the moment about how we can use these linked data to manage in our area, which is Bristol, North Somerset and South Gloucester, once the students come back to Bristol in September, October, once the schools come back, and we've already seen local outbreaks and the consequences for renewed lockdown. And so we want to have really good data that will help us to manage in the event that there are outbreaks in our area later in the year.
Yes, it's been not such a smooth start for you, that's for sure. But really fascinating work coming through now. So what lessons do you think that we've learned, sort of sticking to the COVID theme, what lessons do you think that we've learned so far that we can kind of take forward in the context of the Better Care national priority, from our experiences with COVID so far?
Well, I'm not sure that I have. This is something on which everybody has their opinion, and lots of people have got more knowledge than me. I would say that the COVID-19 has reinforced the central importance of using health data better, and has accelerated progress towards using health data better. And also has reinforced the difficulty in doing that. So even in the context of this national emergency, it's still, unless you were already working on linked data, it takes a very, very long time to assemble data sets and make use of them. On the other hand, the UK has absolutely led the way in the evaluation of drugs to treat COVID-19, and the existing networks, and indeed the existing availability of linked data, has been fundamental to the success of the recovery trial, which is really something in which the UK has led the world in evaluating, and we now have robust answers on the effects of 3 potential drugs to treat COVID-19, one of which clearly works and 2 of which clearly don't. And we're starting to use these large linked data sets to help us to answer other questions. And as I say, the hope is that the availability of those linked data sets will also assist with the story, as we all know, isn't over by any means. So the hope is that availability of linked data sets and close working between researchers and people in the health and social care system will be fundamental to managing during the months ahead, as we need to keep transmission low, do active test, trace, and isolate, and avoid renewed lockdowns.
Yeah, absolutely. I think there's so much that we can take through to the kind of post-COVID era, and in some ways, the worst thing we can do is kind of just go back to where we were, you know, in terms of bringing health data together, kind of pre-COVID. And sort of going back to, having said that, going back to the sort of pre-COVID world of when you were putting together your application for this partnership and thinking about what you would do over the next kind of sort of 2 to 3 years.
3 years.
So what are your longer term, what are your aspirations for longer term impact on, you know, through your better care activities on healthcare in the UK more generally?
Well, for those of you who haven't seen it, the better care model, during the application process, we were introduced to this nice idea of better care loops. And the idea of these better care loops is that we do the research based on linked data, and then we focus on using the outputs of the research to improve healthcare, and then based on the improvement, we start again with the next cycle of improvement. So that's very much how we see the brief from HDR UK, based on the funding we've been given for the next 3 years. That in the 4 areas I've mentioned, we want to do research that, for example, allows us to predict better who will be admitted to intensive care, and then implement these predictions in a way that helps, for example, primary care doctors to identify patients at high risk and avoid those admissions. So our task in the 3 years is to implement these loops, to learn about, for example, predictors of antimicrobial resistance and ways that we can better prescribe antimicrobials. But then once we've done that, to implement those predictions and get the better prescribing, and then if we can learn those lessons, to roll those approaches out more widely, regionally and nationally.
Yeah, fantastic. Filling that implementation gap that we so often see, really, really important. So I've one more question for you. So I'll just remind those listening to log your questions in the Q&A facility, and then we'll come to those next. So there are a couple coming through already, which is great.
Yeah.
So just a final question from me is, so obviously you're joining a network of sort of better care, people involved in better care research and technology. And I just wondered how, and there'll be some listening now who might wonder how you know, collaborations and kind of working together might happen. So what are your plans to kind of work within the existing HDR UK network for better care?
So that's been a really fantastic part of establishing a new HDR UK site, is that these links are already happening. So as many people will know, an HDR UK North site led by Munir Mohammed was established at the same time. They've got some work on antimicrobial prescribing in a rather different context of care homes. And we're already discussing with them how our approaches might be complementary and how we can learn from each other. In the context of COVID-19, again, the links that we've made because of becoming part of the HDR UK family mean that a team at King's have developed a prediction score for intensive care, and we've already done some external validation of that score using data from University Hospitals Bristol Trust and shared that with them. So these collaborations are already happening. We're already participating in national initiatives, particularly the British Heart Foundation Data Science Centre led by HDR UK's Kathy Sudlow. So we're hoping in the Southwest to lead some work looking at the influences of prescribing drugs in primary care on outcomes of COVID-19 based on very large linked data sets that are becoming available. So I think our main priority has to be to do the research we promised to do locally and get these projects underway and make sure we have outputs from them to report within the 3-year timescale. But these links are already happening and we'll be keen to build on them. And that kind of relates to Georgina Moulton's question on the chat about how do we scale findings to other areas. I think the answer is we hope to learn how to do that. But we've got a potential model where we can work with other areas close to us, where we're in contact with people with similar linked data sets in those areas to see if we can scale findings to those, or test approaches that we've developed in those areas. And then for things that seem to work, the hope would be to use these networks to scale out more widely. But how to scale findings is, I think, a key task for the Better Partnerships, and one that we're all going to learn about together.
Yes, yeah, absolutely, and not least through the Better Care Insight sharing days, which are coming up. Yeah, absolutely.
Yeah.
So there's a question around public and patient engagement and involvement. So really important question. So does HDR UK Better Care Southwest include patient, public and carers to frame the research question, or is this research being led without patient, without those types?
So involving patients and the public and carers, and indeed professionals in the research is a fundamental part of HDR UK's approach, and one that we wholeheartedly adopt. And so we're working closely with colleagues in the Bristol, North Somerset and South Gloucestershire Clinical Commissioning Group and the Sustainability and Transformation Partnership, which aims to establish an integrated care system, bringing different parts of the NHS together to work to improve care locally. And they already have established patient and public involvement in what's called the population health management work. So we've got citizens panels which are already operating from them. Our job for each of the projects will be to make sure that as we develop these ideas, that we involve patients and the public in developing the research questions, helping us to interpret the results, and very importantly, ensuring that we're communicating the reasons that we're using these personal data, that we're doing so appropriately, that we're not, that we've got robust processes that mean we're operating under appropriate governance, and that we're not risking confidentiality. So involving patients and the public and carers in all of our work will be fundamentally important.
Yeah, wonderful. Yeah, public and patient and practitioner engagement and involvement. Indeed. Really is at the heart of HDR UK.
Yeah.
So there's a question that's come through actually on the chat. So I'll just read it out there in a similar kind of vein. So any thoughts or plans around feeding back at the patient level on better care work, given the nature of anonymised records for research and GDPR considerations? You've perhaps have partly covered that already, but did you want to add anything to that?
Well, that's a really interesting question, and again, it's one that I think we're just starting to engage with. So in our area, as in many other areas, one of the ways in which linked data are becoming very important is that we've got a shared care record system called Connecting Care. And in many ways, these shared care records do what patients might well have assumed would have happened anyway. But it's really only happening for the first time, that when you go to see your doctor in an acute trust, in our case, that would be University Hospitals Bristol or North Bristol at Southmead, that they have access to summary information from your primary care record, so they can see the drugs that your family doctor has prescribed to you recently, or they can know about diagnoses that have previously been made. And to some extent, I think many patients would see that as an absolute no-brainer, but actually having these shared care records available at the time you seek care is a relatively recent thing. Now, the relevance to us is that if we're going to do these work using linked data, and we, for example, produce better predictions of who's at risk of ending up in intensive care, we want to make that available back to the general practitioner so that they can take action to avoid unplanned admissions to intensive care. And that will involve, I think, what's being got at in the chat, which is providing the information back to professionals and potentially to patients, because for most patients, if you get online access to your GP, that will include access to your record. So we're absolutely at the beginning of this. I think it's something we're all going to have to learn about together. But ensuring that the work, the learning from the research is made available to patients and the public is a direction that we all want to go.
Yeah, absolutely, and yeah, I agreed that that's something that we'll all be working on together.
Yeah.
So, are there any final questions for Jonathan before we move on? I don't know if anyone in the team has any final questions. Here comes Roz.
Hi there. I discovered that as a panelist I can't actually type into the Q&A, so I shall take the prerogative of asking you a question directly, Jonathan. So it was just going back, great ambitions, and really nicely explained of where we're going. If you could have a crystal ball and look back in 3 to 5 years' time and think, what has better care achieved, or what has HDR UK achieved in that particular domain, what would be your big thing on your wish list?
Well, as you can see, because this is a video call, I'm fairly long in the tooth. And so I've done lots of research and I've published lots of papers. But the research I'm most proud of is the research that it's pretty clear how it made a difference subsequently. And so I guess that would be the ambition, that it wouldn't be, I hope we do some great research and we do what researchers like to do, and we publish our findings in top journals and so on and so on. I'm very motivated by that, and that won't change. But what I hope is that if we do that then we will be able to demonstrate that we close those loops, that it made a difference, because this is how the findings were then implemented into routine practice. It's what we've already talked about. It's moving from doing the research to then seeing that there is a loop into changing things in practice. Easy to say, hard to do.
Jonathan, thank you very much for giving up your time this morning to tell us a bit about what you're up to and what's to come, and a very, very warm welcome to HDR UK again.
Thanks very much.
Thank you. So, Ros, it's over to you now for a roundup of latest activities and upcoming events and so on from HDR UK Central. Thanks.
Great, thanks, Melissa. So I'll just share my screen. Hopefully this will work. Let's try. There you go. So Melissa, shout if the slides aren't moving on, because we never quite tell. So hi, as Melissa said, I'm Ros Walker. I'm the Chief Science Strategy Officer here at Health Data Research UK. And I'm just going to rapidly whistle through some news that has happened and events and things over the last 2 months. And it has been quite busy, so I've got quite a lot to cover. Just to say that much of what you'll see in this slide deck is shared in various different ways throughout the time period we're talking about, be that on our Twitter site, within our monthly Hive newsletter, so do subscribe there, and of course on our website as well. So the first thing I want to cover is just say a massive thank you to everybody that joined us for our national conference back in June. So we had actually, I think, over 800 attendees, and I think, you know, in any one session there were about 12. We had over 400 people participating, so that was fantastic, with a range of different views, both nationally and internationally. And I think, you know, lots of great feedback from some fantastic insights that we had from colleagues in Switzerland, Germany, and Singapore, and you know, of course, not least, being the opening plenary being opened by Sir Patrick Vallance, who gave us his very interesting insights into what we already do know and don't know about the COVID pandemic. So we did have some technical difficulties at the start of the day, but I'm pleased to say that all of the slides and recordings, including from that plenary session, are now available on the HDR UK website, so you can take a look there. And it was a fantastic day. So thank you to everybody who came, listened, provided insights, and generally had a discussion on the day. So this is a fantastic just little roundup. That again we'll be publishing, but you know, some really great discussions and lots of things to be learned, and you know, what we really wanted from the day is for people to share their learning, and that was great to see. What we also did was announce our national One Institute prizes. So very many congratulations to the prize winners that were announced at the very end of the day. So the impact of the year went to Ami Banerjee and team, who've been doing some great work modelling the excess deaths that are resulting from COVID and allowing the health system to really focus on that. The team of the year went to John Bradley, looking at one of the HDR UK Gateway Sprint projects actually done last year, and a project particularly looking at rare diseases, which has really set some foundations and really shown what a great team can pull together in a rapid space of time. And an extra call out to Ami and team for also their kind of team response to the COVID crisis. And then last but not least, actually one of the highlights of the day was a session of lightning talks from our early career researchers. Again, we want more of that next year. And the talk that was voted live on the day as making the kind of the most thoughtful presentation went to Albina Lai at UCL. So congratulations to Albina. So just wanted to flag, and this actually happened just before the conference, but it's really important that you're aware of it, is HDR UK has also updated its diversity and inclusion policy, and that's now live on the website. And really we're taking an approach to diversity and inclusion that doesn't just cover people, but as you can see in this triangle, you know, we've got a great opportunity as Health Data Research UK to make sure that data from diverse populations is made available for research, so that we can then use that data to benefit patients and the public, that we add diversity and inclusion to anything that we do in our approach to training, and of course, you know, HDR UK always supports that kind of team science ethos of making sure that we have as much diverse representation within our teams as possible. And we think, you know, ultimately what this does is allow us to deliver our mission. We can't deliver our mission without having a diverse and inclusive approach. We need diverse perspectives, and actually we won't be able to use data to save lives unless we're looking at the people implications of all of this. So actually this work's being led by Melissa, so big shout shout out to Melissa for pulling it all together. And I think what you can expect to see now over the next few months is more specific actions that we'll be taking as a result of this policy. So it was a busy week a few weeks back. So in addition to the One Institute conference, we actually welcomed several of our international advisory board to the conference. And some of you might have seen a great fireside chat with Amy Abernethy and Andrew Morris at the end of the day. But the day later, we then had our first virtual meeting of the International Advisory Board. As with all things in COVID, this was originally planned to be an in-person meeting of the group, but we switched it to online, and it worked really well. So these are, I won't go through all of it in interest of time, but these are the members of the group bringing, really diverse perspectives from across the globe. And really, their resounding feedback, apart from that we bombarded them with quite a lot of information for their first meeting, was that, our vision was absolutely compelling, and the scope of what we were trying to achieve was remarkable. And a great quote from one of the members there that came through at the end of the day, because what we're doing is truly transformative. So they've also given us, as well as kind of some motivation to keep trying hard with what we're doing, some really useful insights and feedback that we'll be integrating into all of our work. And we're hoping that these members really do become our critical friends over the next few months and years, so they can guide us along the way and ensure that we really are doing things that are internationally compelling. And then it's the end of the year. Well, it was at the end of April at least. So what we have also done is published our annual review. So you can again find this online. And what we try to draw out is some of the highlights of the past year. We're still only a young organisation, so only 2 years old, but absolutely great to see the growth in our community and the growth in the insights and the outputs that are being generated by you all. So thank you very much for everything that you're doing, and do take a look at the report, because it's a really nice and great synopsis of all the hard work that's been going on. And this is just some of the kind of facts and figures being pulled out, but really just showing that HDR UK continues to grow at pace. Like I say, we only really started getting going in 2018, but gradually over time, things are really accelerating and building, and that's very exciting. And of course, in all of this time, we've also been pivoting to support the COVID crisis. So hopefully all of you are aware that actually on a was weekly and now fortnightly basis, what we've been trying to do is coordinate all of the great activities going on to support research data efforts in response to the COVID crisis. To accelerate that work, particularly with regards to work with the UK Health Data Research Alliance and how we're working with UK health data custodians to make these data sets safely and securely available to accelerate COVID research. And then really to make sure we're leveraging the best of what's out there, so that we avoid fragmentation and duplication of effort when it's so critical that we make rapid progress during this difficult time. And really what that kind of disseminates into is now a fortnightly report where we take all the great work that's happening out there, and thank you to everybody that contributes both their insights and also gives us the updates on some of the activity happening within trusted research environments across the country. So we can really pull out both the kind of the important messages that we want people like SAGE. So this report goes directly into the government's scientific advisory group, and it also goes to UKRI and NIHR, so they can get at a glance an overview of the great work that's going on, that's being shared openly, which is fantastic to see, but also some of the roadblocks. So what we try to do is pull out recommendations about how can we accelerate things, how can we make things easier, so that we really get to these insights that can have an influence on how policy and the health services implementation of new treatments happens. So all of those reports are made available immediately online, so you can find them all on HDR UK's website and look back at some of the great work that's been happening over the last couple of months. And then getting close to the close is in addition to that, we've expanded our COVID work internationally. So I think it was last week, I might get my dates wrong. We have been working with colleagues across the globe, particularly in the US and Australia, to really think about how we create an international COVID research alliance. So this is expanding on the concept of the UK Health Data Research Alliance. How do we work together to harness data sets and produce benefits to patients and the public? But it's going global. So if you want to know a little bit more about that, there's actually an event happening tomorrow afternoon. So please do register for that and join the team to learn a little bit more about that work. So my very last slide is then just to mention a few other events. So in addition to the International Alliance happening tomorrow, just to flag that we have got our summer school, which is nearly in the summer, in the first week of September, which will also be, as everything at the moment, happening virtually. So registration for that will be opening soon. There's an exciting program shaping up, and please do help us disseminate that so that early career researchers get an opportunity to benefit from it. And then a little bit further away, so this one may be in person. We're optimistic that we'll be able to actually see some people in a physical sense, but if not, the backup of course will be virtually, and that's the next UK Health Data Research Alliance Symposium, which will either be happening in Manchester or online on Tuesday the 1st of December. So that's it from me. So over to you, Melissa, just to see if there's any final Q&As.
Great, thank you, Ros. That was a great overview. We've clearly all had a very busy couple of months, as ever. So yes, if there are any final questions for Ros, then do pop them into the Q&A. I don't think we have any open at the moment, so we'll just give that a couple of moments. But a pretty comprehensive coverage of what we've been up to in the last couple of months and what's coming up. So just to finish off then, so the next webinar will be in a couple of months' time. That would be Tuesday the 1st of September at 11 o'clock, and we'll publicise the presenters a little bit closer to the time, and that will be the week of the summer school. So another plug for the HDR UK Summer School. So it looks like there are no further questions coming in, so I think you probably covered everything there, Ros. Thank you very much. Thanks to all the speakers and everyone who was involved today. Thanks for asking your questions, and we shall see you in a couple of months. Thanks, everyone. Take care.